I am? Hi. It says we're live. So, hi, my name is Myla Flores. I am part of this coalition, Mobilize Maternal Health Coalition. And we have come together, different members, and part of our goal today is to have a pre-event. It's kind of like let's say a dry run, because we're clearly learning. This is the first time we've streamed. This is the first time I've streamed on multiple platforms. And it's exciting to learn now in preparation for next week, February 4th at 1 p.m. So hope you mark your calendar for that. And in the meantime, I would love to share more about what our goals are today. But before doing so, I'll introduce that I am Myla. I am a birth worker for 18 years now, wearing different hats from childbirth education to doula mentorship, working very hard in collaboration with so many people to bring programs such as Womb Bus and recently opening Mariam Reproductive Health and Wellness Clinic in the efforts to one day have a Bronx-based birth center. And that is a little about me, and I am here today representing New York State Birth Center Association as well, a group, a chapter here in New York State who is passionate about having more access to birth centers. And I hope and believe that many of the folks here today are also very passionate and interested in that subject matter, which is what brings you here, hopefully to learn more. I would love to hear in the chat what brings you and what excites you about the possibilities of New York State. And I want to live in that space of hope and encouragement because there's a lot of countering energy that is evident. And so I think it'll be inspiring to hear from folks if you have anything to share about a hope or desire. All right, so I'm going to get started with a little bit. And actually, before I do, I actually want to leave room for that and see if anyone here participating or listening wants to take a moment to acknowledge what you are excited about. Maybe you don't know and you're here to learn. And if you're here to gain a certain thing, please share. Okay, so I will go ahead and share my screen. Okay. Oops. So I'm going to pause here and say that while I was in my technical
Hi, everyone. I'm Samantha Banerjee. I am also a member of the Mobilize Maternal Health Coalition here with Myla. She is having some internet issues today, as you can see, but we are working on getting her back up. Our plan for today is to use this as some time to talk together as a community and learn about first of all, why you all are here, what you are excited about, the changes that we want to see in New York State and across the nation when it comes to maternal health and ending the crises of maternal mortality and stillbirth. And we this is going to be the first of a series of teach-ins, which will all be free, recorded, and available online, so you can refer back at any time. So today, Mila is going to be, and a few of our other guests and members of the coalition are going to be sharing about the current state of maternal health in New York, particularly when it comes to birth centers and the difficulty that providers in New York State have had with making more birthing centers available and making sure that certified professional midwives are available to any parents who want to choose that mode of prenatal care. And then once Mila is through, I am going to do a quick intro on stillbirth in New York State to give you a little teaser of what you'll see in one of the upcoming teach-in sessions. And we plan to have several of these over the next few months, particularly during the New York 2025 legislative session. And our hope is that we can empower everyone to understand the issues, know what is going on here, what the challenges that are being faced by birthing people and their babies in New York, and how we can improve outcomes across the board, particularly for Black and Brown families who, as we know, are disproportionately affected by adverse pregnancy outcomes. And then finally, at the end, Mila will pop back on to share a little bit more about the event that we have coming up next week. Mila is still working on getting back in here, so I wanted to share some of the conversation in the chat. Thank you all for telling us about yourselves. I see Trinisha is here, and she is looking for access to better maternity care for all people, and with Haven Midwifery Collective. Marnie from Push, from Powered Pregnancy, that's one of my colleagues. Hey, Marn. Would love to see how we can improve maternal mortality and morbidity rates and reduce stillbirth in New York. Anna Lepe-Vic, also from the Push team, is asking, I'd like to know how advocates outside New York can help, and that's definitely something that we will be touching on. Katie from Brooklyn says something that makes her hopeful is that New York is the 12th largest economy in the world, so we can afford any social programs that there is to make sure there's mass support for all. That is a really good point. No more excuses. We have a comment here from Witch on Fire. We need more midwives. CPMs need to be licensed. Trinisha echoing, more birth centers in New York State. Midwives parking bill in New York State is needed. Nicole is also chiming in to say licensure for CPM, more birthing centers, and options for families and insurance support. And I think we've got Mila back here, so I'm going to bring her back on stage. Welcome back, Mila.
Hi. Oh my gosh. Thank you so much. So here I'm going to share my screen. I think I'm good now. I just moved like 2 inches from a week. And I thought it was better, but it kind of got worse. Okay. So, hi all. Thanks for your patience. I don't know if you heard, but I just got a new router. I thought it would have made things better, but it kind of made things worse, and I'm still struggling. But I moved 2 feet away from it, and I think we'll be fine. I'm going to share my screen. All right. Okay, so hopefully you all can still see me and my screen. I am just looking at my full screen, and I will start here and say that we hope that today
Oh no, I think Mila's router has abandoned us again. I actually have a copy of Mila's slides here, so I will pull them up to share. And I think she is going to try to join us via her phone instead, and hopefully that will work better. So just give me one moment to get this up here, and then I can show you guys what Mila had to share today. Thank you again all for bearing with us. We are, as you know, a group of grassroots community-based advocates. We are all volunteers here just trying to get the word out and educate the public about maternal health and how to improve outcomes for moms and babies. And so we are learning as we go, building the plane as we fly it. This is how the sausage gets made. So thank you all for being here. And yes, I see doula for Queen in the chat. Patience is a virtue we all possess, especially in the birth world, right? So thank you so much for your patience. All right. So I will get us going, and then as soon as Mila can get back in, she's gonna try to log in from her phone, and then I will pass it back over to her. But what Mila was looking to share today was some more in-depth information about freestanding birth centers in New York. What, why, and how are they needed, and what can we do to get more of them? Sorry, lost my mouse on the two screens here. Okay, so we are going to go over the definition of birth centers in New York, the rise of birth centers in the U.S., the outcomes and cost savings that we see from birth centers, and then touch on the strong start that it gives moms and babies, and how it addresses disparities and personal connection. So, what is a birth center? Birth center is a safe healthcare facility for children where care is provided in the midwifery and wellness model. This is this phrase is into maxi home versus mini hospital. So as you can see from the photo, it's a lot more homier of an environment than what you would see in a typical hospital. But has many of the same healthcare facilities in order to facilitate, your average low risk birth. So the philosophy behind birth centers is that this can be an integrated part of the healthcare system, which is guided by principles of prevention, sensitivity, safety, appropriate medical intervention, and cost effectiveness. And while the practice of midwifery and the support of physiologic birth and newborn transition may occur in other settings, this is the exclusive model of care in a birth center. And something that I think is really critical to recognize is that you know, oh, I think we got Mila back. Here we go. All right, Mila, take it over.
Okay, you can hear me. Okay, great. So you guys know that we are now in the part where we're learning about birth centers, and it is basically an in-between option. I'm sure that you guys learned about already the benefits of the wellness model of being able to access care that is not necessarily a home, but it has a home environment, and it has the beautiful options of the comfort and safety of professional midwife who is caring for the family in a holistic way. We want to integrate this in harmony with hospital settings in our healthcare system. Excuse me, we want to integrate alongside hospitals in our healthcare system. Birth centers should be independently freestanding and running in ways that communities can access this valuable kind of care. So part of when birth centers are integrated into the healthcare system, we know that there is a opportunity to prevent some of the common interventions and mortalities and morbidities that we see by caring for people in a whole way, the way that midwifery model of care leans into. And there's a sensitivity to all that a person is going through, not just the clinical component of what's happening, but also the emotional, the community aspects. And so we aim to create an environment of safety, sanctity, being held in ways that blossoming individual and their family and loved ones should be. It is appropriate way to care for folks, and we have medical interventions in the setting of a birth center. In, for instance, circumstances where an IV is necessary and antibiotics, circumstances where post-birth there are certain measures that need to be taken in order to support a postpartum hemorrhage. These are things that wonderful midwives who are experienced in their setting, which we will get to more about because some people are here present who are midwives, and we're so glad you came, and that we'll have some perspective as well of the different professionals that we want to have access to here in our state as well. And let's just give a shout out to certified professional midwives, a licensure that is recognized in 38 states, and New York deserves to have that option. But you guys will learn much more about that. Today you'll get a sneak peek, and we'll have a teach-in specifically centered around that topic and where we're at with New York in that. So back to this concept of people receiving the appropriate medical care, there's also a cost effectiveness to the whole of it. And when we think of cost effectiveness, we think of, just the fact that, less money is being spent, but there's a value that's being added that is way beyond the cost. And so when I say cost effectiveness, I'm referring to the amount of funds that are going into our care when it comes to the insurances paying for the expensive we'll get to a slide where you'll see a lot more specificity around how we can be saving ourselves as well as our government funds. It's a very logical approach to being able to interrupt the whole business aspect, the assembly line of what birth has become in many places throughout, United States and beyond, which is clearly an issue. Meanwhile, there's ways to bring back the model of care that is not only life-saving and improving outcomes and experiences, but saves money. We'll get there. So while the practice of midwifery and the support of physiological birth and newborn transition also occurs in other settings like the hospital, this is the exclusive model of care in a birth center. And for those that are like, what do you mean physiological birth, newborn transition? It's the basis of being able to know and understand the body and the normalcies of how birth functions, the ingredients of what's involved between the baby, the pelvis, the hormones, all of the uterine functions, and really trusting that way to let birth unfold in the ways that our bodies really know how. And so with 85% of people, our population, being considered low risk, and birth center access is designed and intended for people who are low risk birthing people, we know that 85% of people should at least have the access to this type of model of care where physiological birth is respected. And moving on, okay? So we respect and facilitate a person's right to make informed choices about their health and their care based on their values and beliefs. The birthing person's family is integrated into the experience and supported as well in all of pregnancy, birth, and postpartum. So here is a little sneak peek on, or just an understanding of how birth center care is the need and the interest is growing. And first of all, just seeing how it has grown from this number was also in 2020, so 384 and growing. That's how many midwifery-led birth centers are throughout the United States. And then, like, put in perspective how much of a part of the United States New York State is. Think of our population. Think about how we are one of the 5 most populous states in our country, and yet our numbers have gone down. There's an acknowledgement that there are so many birth centers that used to exist that were affiliated with hospitals, and they are no longer here. Okay, so that's an issue. And so when we look at these birth centers throughout the US, we also know that there has been a 200% increase. And also, I want to name quickly from last year, the current numbers is that there are 414 birth centers in the United States. 21 of them are BIPOC led, and 1 in New York is CABC accredited, and 2 are in progress, okay? And 0 amongst those are BIPOC midwifery-led birth centers. So this is something we're aiming to do, and we will be sharing more about our individual stories at the end of this presentation, where there are different individuals who have shared their journeys. But let's also name that birth centers are beneficial, lowering cesarean rates, improving outcomes, and I mentioned the cost savings and increased client satisfaction. And so when we look at this, you can just take a read here that this is some of the stats that we don't want to spend too much time on, but we just know this exists. This is part of the issue that we're aiming to solve. And so in doing so, we have to also acknowledge the problem, right? The problem itself. And so part of what we want to acknowledge as well with Black maternal health, and knowing that the value of having birth centers can help change the tides and redirect the numbers, because here, I mean, sadly enough, it hasn't been improving significantly. And maybe some of us very unfortunately can name circumstances in the past few years, people we've known. And these statistics are not just numbers, they're people. And it's disheartening, but also what is a huge driving force behind why we need to make change and get our community to have the greater interest in taking part in that change. And consumer awareness is a big part of it, and why we are discussing here some of what direction we can go. So this is when we were talking about the numbers, okay? So I'm gonna move on, just acknowledge here that many births in the States, around 50%, are covered by Medicaid. And that's gonna help inform this slide, which I want you guys to understand when I mention the cost savings. That there was a Washington, D.C. Medicaid study where we learned that there's approximately $1,163 saved per birth when birth happens at a birth center. And it's actually significantly more now, but let's just go with that particular study that was Howell, Palmer, and Benatar and Garrett. And from that number, think about what it could mean in New York State. So New York State just pulled 1 year. We just pulled 1 year of how many birth certificates happened in New York State. 207,590. Okay, follow me now. The estimated amount of people who are giving birth on Medicaid is 50%. So what's half of that? 103,795. Okay, so how many of those people are low risk? 85%. So now we have 88,000-ish, okay? Now with that, we're doing a potential cost savings. If we were to integrate birth center care into more neighborhoods, more boroughs, more regions, we could at least offer the potential cost savings to our state of 100 million plus, okay? And so what are we spending money on when we could use 100 million towards productive things? That there's a plethora of community solutions out there that I'm sure we could brainstorm, but just think from birth alone. And yes, not every person is going to consider a birth in a birth center setting, but every person who is low risk should have the option and opportunity to consider for themselves if it makes sense for them and their family. I'm sorry I can't read the chat right now, but we'll raise, Charlene will raise a few questions in the end of what we can acknowledge as well. And so here's some implications on Medicaid, just again, recognizing that there are state regulations that limit birth center access to pregnant people, but meanwhile, federally, and I don't want to get into too deep because I've read the news recently, but to date, you know, federally, freestanding birth centers are required to receive reimbursement for the care, the service, as well as the facility of offering that. So birth centers, when they exist, should be able to sustain themselves through being able to be paid via Medicaid or people's insurances or privately to be able to continue running. And it's mandated that that is possible. But you know how it's possible is with licensure. So part of what we're discussing today is the fact that there are no licensed birth centers that have sprouted since 2021, when the midwifery birth center bill was passed. And that's an issue. And so even though we happen to be en route to opening a birth center, we also are very concerned about all of the efforts collectively that need access to open their birth centers, okay? And so we'll get to that part, but this slide was supposed to have a moment to brainstorm what kind of community programs and collaborative programs can happen in a birth center setting. And just picturing that, another moment of like, what kind of ecosystem is a birth center creating within its community. And I could really just be in that mode if this was like Zoom, where we would like open up the mics and hear people. But that excites me. And here are some very simple examples is what was included in when they did a Strong Start study of the birth centers throughout the US. They had midwifery and model of care, of course. They had family standard clinical care and coordinated with sometimes home environment, and then also group prenatal care where people could connect with each other as well as get their prenatal care taken care of. And there's so many other kinds of programs that can happen. Lactation clinics, parent groups, baby meetups, I don't know, you name it. But yeah, so here's some acknowledgement of that study that was done, what the outcomes were. And just take a look here at the preterm birth, low birth weight, very low birth weight, primary cesarean rates, and total cesarean rates. When we looked at the United States as a whole, and then you compare it to all the birth centers that were involved in that Strong Start study, you could see a significant decrease in instances that people were experiencing these conditions and these infant and maternal and infant health indicators. So why would we not be able to access this clearly beneficial care? And now just to look even more at the numbers, when we separate it in a more detailed way that includes all races, and then Black and African American race, you could see here all of those same indicators when you look significantly better in birth centers. And there are obviously now, thankfully, not obviously, but there are more Black and people of color led birth centers that have been sprouting in community. And also I'll share more about what's been happening with birth center equity in policy relevant way. But for now, just know that there are more birth centers sprouting, and so New York is due for our sprouting of many more birth centers. Okay, so I'm going to shift gears now here to our stories. Okay, we have some minutes here, and hopefully a couple people can share. I know that we had some entry. So I think since we're like one speaker at a time, what I'll do is prep Kim to read maybe, well, first I'll give a little background, but we've received different statements about people's journeys. And I wonder if we can go back and forth with this one, Samantha. Trinisha Williams, who has opened Haven, or who's working to open soon enough, hopefully, is working to open Haven Midwifery Birth Center. And then Bridget from Radiant Wellness. I can actually pull up their stories now if easiest and best. And then myself and the Coit House in Buffalo, and the efforts of Love Child, and kind of just where they're at now, okay? So, oh, yay, hi. So I was thinking, Kim, I will give a short update about where the birthing place is, and if you wouldn't mind representing Trinisha, and then I'll tell a one sentence version of Bridget and Nilu, and then we'll read Maura's statement. And so then that way you folks can get an idea of some of the many efforts that are going on in New York State. And we also, I'm gonna like freshen up on what's happened in the chat here, but we welcome questions. And after our Q&A, or excuse me, maybe before our Q&A, regardless of how many questions we get to, we're gonna note what they are so that in a upcoming teach-in, we'll be able to like update people on where we're at if there's more information that people want. All right. So the birthing place is essentially working very hard. We got our mobile wellness clinic up. We were moving around in 2022 to many neighborhoods, innovatively thinking, it's okay, innovatively working to reach our community more immediately. And then we got to our really lovely stage where we have a clinic now. It's called Mariam Reproductive Health and Wellness Clinic, with a collaboration of OBGYN, midwives, lactation consultant, and acupuncturist, and parent groups, as well as other supportive wraparound care that is helpful. Meanwhile, we are not catching babies yet. We just got a Medicaid number, as well as working to get credentialed with insurance companies, because we got a crazy ass quote for malpractice insurance, because that's necessary to have a birth center. And so we are basically going through the obstacles and moving in our best way forward. And so it's hard, but we're doing it. And the only reason why we're doing it is, unfortunately, but yet fortunately for us, unfortunately, we're having to operate within the old model of licensure. So therefore, an OBGYN has to be the medical director, or an MD, right, would have to be the medical director. And there are other efforts that are following a similar model. But part of the bill we were aiming to pass in the first place was so that midwives of color, midwives within their community, could open and support and serve their community within their birth center. So depending on, Kim, if you might have Trinicia's available, then I'll pull up the next one, okay? Kim, I think you're on mute, honey. Well, Kim, when you're done reading Trinicia's, if you're not ready, just tell me and I'll read. But otherwise, because I for some reason can't hear you, but I think everyone else can, because I'm on my phone. So it's not like, I'm gonna just go with sign language. Like, your turn. I'm not gonna try to hear you. I just know that your job right now is to read Trinicia's, and then I'll pick it up and you just pass it back to me. Sorry. Oh, okay. Others can't hear you either. Okay. In that case, great. So my hope is that we'll just darn. Okay. So let's see. I have Maura's on hand, and I'll share that Maura. Oh, here's Trinicia's. Great. Okay. So Trinicia shares that one of her primary challenges has been securing an appropriate rental space. In New York, Suitable locations that meet the specific requirements for a birthing center are scarce and often come at an exorbitant cost. The need for space that accommodates both clinical and administrative functions while providing a welcoming and comfortable environment for expectant families further complicates the search. It's additionally hard to manage real estate hurdles. The cost of malpractice insurance for a birthing center is another significant financial burden, and the premiums are notably high, reflecting a perceived risk associated with birth centers, despite evidence supporting their safety and efficacy. This financial strain can be a deterrent for many midwives and healthcare providers considering opening a facility. Furthermore, navigating the certificate of need process in New York presents its own set of challenges. The certificate of need process is intended to ensure that new healthcare facilities meet a genuine community need, but it can be lengthy and cumbersome, often requiring extensive documentation and justification. This delays the opening of a birth center and increases the initial investment needed to maintain momentum throughout the approval process. Despite these obstacles, the vision of Haven Midwifery Collective remains steadfast. Our mission is to provide a sanctuary where women and birthing people can experience childbirth in a supportive and empowering environment. The journey to realizing this vision is undoubtedly complex, but is driven by a deep commitment to enhancing the quality of maternal care. So thank you, Trinisha, for that contribution. We honor your efforts and we see you, and I'm going to move on and read, actually in that slide you saw Trinisha was Haven, and then we saw Radiant Wellness, and I just want to acknowledge that there were very similar parts of her journey that have caused, let's just call it a pause, right? I to some extent, I would have loved to drop in the chat, because there could be people here who don't know that we have a form, and we'll put it in the follow-up after, but a form that we ask people, if you have ever taken part in an effort to open a birth center in New York State, to please fill out this form so we understand what your challenges are. And of the 18 responses, there's a good portion of people who have very similar challenges. And so the birth center report that we're working on, that is soon to be published, that we contributed to, many other of the people working to open birth centers contributed to, will come out from the Bronx Borough President's office soon. There's a white paper that Jemani Williams' office is working on. There's other work being done simultaneous, but back to our stories, Radiant is struggling as well. I would give a joyful nod to Love Child, Nilu Shuti, who, even though they're experiencing the same challenges, I want to acknowledge that, around the time the bill was passing, Nilu was a student midwife, and now she is a full-fledged midwife serving in a hospital in the New York, in Manhattan, serving New Yorkers. So, and then lastly, I want to read Maura's statement. I'm a certified nurse midwife who applied for birth center accreditation with the Commission for Accreditation of Birth Centers, CABC, and licensure with the Department of Health, DOH, at the same time. Despite the fact that my birth center, the Coit House, was accredited and re-accredited in 2021 and 2024, I've been unable to obtain licensure of the facility from the DOH. Not only has the certificate of need licensure process stretched on for nearly 5 years with no end in sight, I spent hundreds of thousands of dollars in legal and consulting fees in an attempt to obtain a birth center license. My birth center is in Buffalo. It's the only option in my community for out-of-hospital birth and serves its clients from
a 2 or 3 hour radius who are unable to locate community birth options where they live. The fact that Coit House achieved accreditation twice from the CABC, the gold standard of accreditation, and has been unable to obtain licensure in our state indicates a malfunctioning of the birth center licensure process. The DOH has publicly maligned my birth center, implying issues with safety and quality of care that clearly do not exist, given I've achieved and maintained the gold standard of accreditation and am valued by the families I serve. Further, denying licensure in the name of upholding safety is an illogical premise. If the DOH intended to create a safe birthing space for birthing people in New York, they'd prioritize licensure and therefore regulation of birth centers. So the Coit House, so you guys know, is already serving people far and wide. They have such a diverse population, 40 of whom are 40% are BIPOC, 70% are of Medicaid managed care, and it's serving critical needs in Western New York. And we all know that there are regions throughout our state that are further from hospitals, and so many rural areas that are often not part of the story. And we want to acknowledge that there is birth center efforts happening in those areas, and it is very concerning that they're not only in this case being limited to the sustainability that they deserve, but having to invest so much more time and energy than is fair. And the people of New York who deserve these services are then getting the short end of the stick, because then the birth centers won't be able to open. And so what can we do about it, right? And so this is why we're here, y'all. And in the effort to acknowledge that part of our goal today was to share like the benefits of birth centers, but also the current picture in New York State, we also want to acknowledge, first of all, I want to send these acknowledgements because we got really sweet pictures from her name's not even in here. Oh yeah, Nicole Photography, Monet Nicole Photography, Jazz Birth Center, which closed, and Magnolia. And so really just thanking everyone. And then you can do a quick little piece of the references, but really, is that me who needs to share my screen? Yeah, okay, good. We can depart from this slide presentation, because my goal now is to open up the floor, hopefully, for some Q&A and see what's relevant there. And hopefully we can strategize. Part of our hope together is to update you that on behalf of New York State Birth Center Association, we are not yet aligned on legislatively what we want to do about this. There are directions we can go. We ultimately are very excited about the simultaneous efforts that are happening with New York CPM, and knowing that birth centers in New York, the workforce, that it's important to to uplift additional policy that goes hand in hand with birth centers existing, as well as so we can go in the direction of like what we're doing now is like elevating all the maternal health issues. We can figure out how to either reintroduce the bill in a responsible way, since it already passed, right? And then also one idea is to pass more law that supports us as a whole to open. So I want you guys to know, I think it's good to share that I was able to submit a $30 million proposal to the governor to support New York State birth centers in being able to either acquire land or site access to the properties that they wish to grow or build their birth centers, or manage. That's one way they could use the funds. Two, to support with the malpractice insurance, which is incredibly high. And three, to help certain birth centers who are far along navigate the certificate of need process, which is still the existing barrier. Ultimately, we know everyone who's on this side of like having to, who's been trying, knows that the certificate of need is the key culprit in the whole story. So yeah, join our coalition. You can see there the link to connect and stay connected. And let's see, I think I wonder if, since we're kind of over time now, if I could hand this over to our other co-presenters to share a sneak peek of just like the overview of what the other initiatives we're working on, as well as making sure that you guys know that we're going to do additional comprehensive teach-ins about each one. Hi, Tisha.
Great. Hello. Hello, everybody. Thank you, Mila, so much. And thank you for such a wonderful recovery from the technological challenges. Can everyone hear me?
Perfect.
Am I being heard? Great. Thanks. Welcome, everybody. It's such an honor and a pleasure to be here, because I wanted to let everybody know what we're doing here in terms of this coalition is that we are giving birth to a movement in New York to really expand options for birthing families that include birth centers, that include out-of-hospital birth in all parts of the state, that include services and paid family leave for families who experience pregnancy loss. So without getting into all the details, I want to welcome you to the birthing process. We are all midwifing and doula-ing these issues to bring them to everybody's attention, to bring them to the attention of legislators, and to bring them into the legal status and the up and running status that they all deserve. So very quickly, I am a certified professional midwife, and I am here to represent New York certified professional midwives. We're going to do a teach-in at a further date, probably at the end of February. NYCPM will have the floor for talking about the issues related to providing a mechanism. We are looking to provide a mechanism in the state of New York for a license for CPMs. So CPMs are specifically trained in out-of-hospital births. So we, of course, welcome and applaud the efforts to get more midwife-led birthing centers up and running. We could work in birthing centers. We are specifically trained. We're the only midwife credential that is explicitly trained in out-of-hospital birth. So we're looking to expand the option for home birth for families who are seeking that option. Right now, if you are attending a birth, even though we are credentialed, we are experienced, we are certified, and almost all CPMs that I know in New York are licensed in other states, we are considered felons when we attend a birth because we are practicing without a license, primarily because the state does not have a mechanism to license us. So we'll talk more about that, but we do want to serve the many, many families and communities across the state of New York in which there are no maternity care services. We have 20 counties in the state of New York that has zero maternity care options, no hospitals, no OBs, no midwives, no nothing. So we're looking to decrease the gap in maternal health care. We're also looking to address the maternal mortality crisis with regard to racial disparities, because we're looking to be able to license community midwives in their communities of color, various religious communities, those midwives serving their own communities with cultural competence and sensitivity. So we're in that regard, we are looking to be able to provide those services that we know decrease maternal mortality and infant mortality and morbidity. And then finally, we're looking to be able to work in the birth centers that we really hope will be opening up all over the state once we are able to really kind of crack that nut and be able to really let the midwife-led birthing center movement flourish as it should, and as I know we would all be very thrilled to see. On that note, just for the sake of time, I mean, I have a lot to say about CPMs, but know that we are working on legislation. We will be listing and be involved with all of you who are now part of our coalition and staying, kind of connected to our coalition, ways that you can support the CPM licensing bill effort. And on that note, I think I'll pass it on to Samantha, who wants to say a couple of words about the organization and of the issue that she represents. And I'll very much look forward to seeing everybody again next time.
Thank you so much, Tisha, and thank you, Mila, for the in-depth presentation about birth centers. I know we're all looking forward to learning more. So I'm going to just give a quick overview of stillbirth in New York State. This is an issue that you don't hear much about, even though it's very intimately related to the maternal mortality morbidity crisis and the lack of options when it comes to birthing and pregnancy care. Let's just see if this is working. So quick intro, my name is Samantha Banerjee. I'm the Executive Director of Push for Empower Pregnancy. We are a national 501c3 nonprofit dedicated to eradicating preventable stillbirth in the U.S. by 2035. We are doing this through a combination of top-down systemic change and grassroots advocacy. And we are New York-based, though our work is national. We were founded in 2021. I and everyone on my team are parents who have actually lost a child to stillbirth. We are all volunteers right now and have been since we started, though this year our big goal is to professionalize and get some paid staff on hand here. And I think the thing that really sets us apart, especially in the stillbirth world, is that we are a values-driven organization. You know, the families both on our team and who we represent and partner with are inclusive and diverse. We work to center Black and Brown families in everything that we do in an effort to dismantle systemic racism and white supremacy culture and ensure that, every family has access to, equitable care. And we are unapologetic and bold in everything that we do. So quick overview, the numbers around stillbirth are staggering. And even many public health and medical professionals are shocked to learn this. So in just the 5 boroughs of New York City, 900 babies are born still every single year. If you scale it up nationally, we are actually losing, it's more than 20,000 children every single year in the United States. That is the equivalent of 3 kindergarten classes being wiped out every single day. Or put another way, that's 65 families coming home with an empty infant carrier every day in this country. Stillbirth is tied intimately to the maternal health crisis, but is far too often overlooked. Moms who've had a stillbirth are at almost 5 times increased risk of severe, potentially life-threatening maternal complications. And just as we see with maternal mortality and morbidity, Black moms are more than twice as likely to suffer a stillbirth. And this is not due solely, access and social drivers of health are a factor, but a very large portion of this disparity is simply coming down to systemic racism, because even moms who are educated and wealthy and very informed about the risks that they are facing can and do fall victim to this crisis every single day. And a perfect example of this is Crystal Anderson, who's pictured here. Many of you may have heard her story when she transitioned earlier last year in 2024. Crystal is mom to 2 babies, Charlotte and James. James was born still in 2022, and Charlotte, unfortunately, in 2024. And just a few days after giving birth to Charlotte, Crystal came down with sepsis and tragically lost her own life. Now, Crystal was a Kansas City Chiefs cheerleader for many years. She was in absolutely perfect physical health. She worked in technology, specifically building technology to address the Black maternal health crisis. So she knew what she was doing and she knew what she was up against. She has a loving husband and father to her 2 babies, who was right by her through the entire journey. And even with, the best support and much more privilege than many people in this country have, Crystal still fell victim to what is going on. And so, she's only one story out of many out there. And so we want to take a moment to say Crystal's name, make sure she's acknowledged, and all of the other moms and babies that we are losing to potentially preventable deaths every day in this country. One of the reasons that this is happening is because there is a misconception that stillbirth is not preventable. However, the data directly contradicts that. Conservatively, studies done in the US using current tools and technologies show that at least 1 in 4 of those stillbirths are preventable. And that includes nearly half, 47% of stillbirths that are taking place at term. That's at 37 weeks or later. These deaths are not inevitable. These moms and babies are not sick. 80% of stillbirths are taking place in pregnancies where there are no known maternal risk factors at the start of the pregnancy. And in pretty much every case, these parents, and in many cases, even their providers, are not actually doing anything wrong. So the main takeaway is that for expectant parents, stillbirth education and patient-centered prenatal care, like you can find at a birthing center or at a hospital that has been trained to, center patient experiences and trauma-informed care, can be the difference between life and death. And we can do better. 55% of stillbirth mothers are never told by their provider about the importance of monitoring fetal movement during their pregnancy. The reason for this is because in the United States, the governing body that sets the standards for prenatal care, the American College of Obstetrics and Gynecology, also known as ACOG, ACOG guidelines around fetal movement education are not actionable, not accessible to the average person, and they're not equitable or clear. If you compare the guidelines that are put out by some of our international peers in the UK or Australia, you can see that what providers and patients there are being taught is much more actionable and much more clear. And so as a result, myths and misinformation about, particularly about fetal movement, are rampant. We're actually in a process right now at PUSH. We have a project going called the Internet Scrub, where you're going one by one to all major pregnancy websites and pointing out to them all of the misinformation that is being given to parents. Things like, the 10 kicks in 2 hours, that is an outdated standard that does not apply to every baby. Or things like, if you notice a change in movements, the first thing you should do is, drink juice and poke your belly. That is absolutely terrible advice that is literally just wasting time. When if the parents have a concern about fetal movements, they need to go be seen immediately. Every time, even if you have an appointment, the next day, or you had one earlier that day, that is a warning sign for both fetal and maternal distress. But again, this is not clearly laid out in a way that providers are being taught to teach their patients. Worse, we know that if we matched the rates of our best international peers, we could potentially be preventing up to 75% of U.S. stillbirths. So, those top-down stillbirth prevention efforts are proven to reduce rates worldwide, and we as a country, and particularly here in New York State, need to do more. One of the big misconceptions, again, driving this is that the thought that stillbirth is rare, but that unfortunately just is not true. Stillbirth actually claims more children's lives in the U.S. up to age 14 per CDC data than prematurity, SIDS, car accidents, drowning, guns, fire, poison, flu, and listeria combined. And just like all of those other, much more common childhood risks, not every stillbirth will ever be preventable because sometimes accidents happen, but there are many things you can do to lower your risk. The difference is that no one is telling parents about this until it's already too late. And just to give you a visual of the scale, this piece of artwork is from our Big Push Empty Stroller March on DC, which took place in October of 2022. And this mural is actually made of 23,000 baby hats. Those little hats that everyone that all the hospitals give you. 23,000 of those, one for every baby that was born still that year in the United States. And many of those actually have tucked inside of them the name of an actual child that it was put there in memory of. So this, unfortunately, is affecting far more families than we realize. And so it's time that we are arming providers, policymakers, and parents with evidence-based knowledge to drive down the incidence of stillbirth. We are doing this through 3 different ways: education of providers and parents and raising awareness, advocacy with prenatal medicine leadership and public health, and through government and community efforts, and then finally going directly to parents with grassroots information. So how you can help. And again, we could talk a lot more about this in a future session. But the main thing is that, systemic change takes time. And with 65 babies dying every single day, time is one thing we do not have. And so we have made available some things that we can do to empower families today. If you go to the PUSH website, pushpregnancy.org/tips, or follow us on your favorite social media platforms at Push Pregnancy, we have a ton of free resources for anyone who is pregnant to learn, warning signs of maternal and fetal distress, learn how to advocate for yourself, know how to monitor fetal movement, know what's normal for your baby, and just really teach you to trust your intuition and know that you are the authority on your own pregnancy, and that your provider should want to hear from you. And so those are always free and often available in Spanish, and we're working on making more available. And then for providers, we are about to release accredited training modules online, and it is accredited for physicians, nurses, and certified nurse midwives, and mental health professionals about stillbirth prevention and pregnancy after loss. And then as you see pictured here, we also have these educational materials. Digital formats of those are available in English and Spanish on our website for anybody to download and save and put on your phone or print out and stick on your fridge. But you can also from our website order printed copies of those in both posters and handheld size that you can use for patient education. And for all the things that we offer to providers, it's also critical to note that if you are someone who is serving predominantly marginalized communities, whether that's BIPOC families, LGBTQ families, immigrant families, basically anyone who is at a higher risk of stillbirth, we are more than willing to work with you on pricing and discounts to make sure that you can make this information available to your community, whatever way works best. So to finish up, we are looking forward to the February 4th session, which is going to be a live press conference. Mila is going to tell you a little bit more about in a second. But the thing that we are really focused on right now is fighting for paid family leave in New York for stillbirth families. So right now, there's up to 4 moms per day who are having a stillbirth in New York State. And 60% of those are eligible for paid family leave, which means that they have been paying into the system out of their own paychecks for years. During their pregnancy, they are approved for up to $1,100 a week of paid leave after giving birth. And then when they go on to unexpectedly have a stillbirth, the state is actually revoking that leave that they were promised and which they paid for. And most concerningly, this is happening just days after birthing and burying a child, in many cases a full-term baby. So these moms are facing the same exact postpartum experiences as everyone else. As we talked about earlier, they're at even higher risk of having severe maternal complications that could potentially be life-threatening. And this is happening during the 6 weeks when moms are most at risk of losing their lives after pregnancy. And of course, again, this burden is predominantly falling on Black and Brown families, especially in New York State. So we encourage you to join us on February 4th to learn more and hear directly from some parents who have been affected by that. We are also in the process of a major awareness campaign to call in healthcare providers and inspire them to help us fight for changes in prenatal care. This is built around a short film, which is 7 minutes long, and you can watch it at Still. And finally, we are working towards fighting for federal appropriations for stillbirth funding, which will improve birth outcomes across the board, which is fantastic because there are many of the same root causes between stillbirth and other adverse maternal health outcomes. And we want to make sure that the people at the CDC and HRSA and the NIH, who are all working so hard to address stillbirth, have the funds that they need to make that a reality. And we are very encouraged and hopeful. We know this is possible because it's happened right here in New York. Starting January 1st, so that was just earlier this month, New York State launched the nation's first paid prenatal leave benefits. So it is now law that any privately employed workers in New York State are eligible to receive an additional 20 hours of paid sick leave for prenatal care. So this includes any healthcare services received, during your pregnancy, including routine or emergency physical examinations, medical procedures, including fertility treatment and IVF, any monitoring or testing that you need done, having discussions with your provider to plan for your birth or talk through your care options, and also end of pregnancy care appointments. About 130,000 pregnant New Yorkers will benefit from this each year. And this is critical because we know that, moms who do not get to utilize the prenatal care they have access to are at 5 times, or I think 3 times higher risk of losing their lives due to complications of pregnancy or childbirth. And their babies are 5 times more likely to lose their lives. So we encourage, if you or anyone you know is pregnant, we encourage you to take advantage of those amazing, first in the nation benefits. And you can learn more at newyork.gov/prenatal. And that's all I have for you today. But we hope you'll join us at a future session. We are proud members of the Mobilize Maternal Health Coalition, and we hope that you will join us as well. And don't hesitate to reach out. And I'm going to bring Mila back to finish us off. Oh, you're muted.
Amazing. Thank you so much, Samantha, for sharing more about what PUSH is all about. And we look forward to considering all of the range of maternal health legislation and policy to bring to our attention. So if you are a part of any group whatsoever, and if anyone can pull up the slides to do the last 2 with me, feel free to, but otherwise, I think I can hold it down by starting with what was possible. And so you've just heard about 3 subjects that all go hand in different ways. We want to make sure that they're all listened to. As Tisha said earlier, if you're one group saying one big message, it is so much more difficult than if you are a coalition of groups sharing the messaging of what's important to all of you. And that's what we're aiming to do right now with this coalition, with a few members, and we're in contact with others, some of whom will be joining our February 4th virtual press conference. And folks are excited to be a part of this, and we're excited to continue growing and making our voice louder so that we can consider creating a resource that policymakers and decision makers can use to understand the landscape of midwifery. We were working recently with, I'm sorry, there's a call coming in and it's not going away, but you guys can hear me, right? Okay, so there is a wonderful group of people with the Birth Center Equity that has created a policy blueprint, and they haven't created it. We're actually, a few of our members in New York State are collaborating and started meeting just this year in recent weeks to help create that resource for decision makers and policy makers to be informed by the community that they're serving. And so whatever advocates that are existing state to state, we want to be able to just uplift and acknowledge that our goal, our shared goal, really centers a lot about access to midwives and birth centers, and that the leaders in the community centered efforts can be involved in the conversations with policymakers and potential improvements. And so basically, we hope we can, as a collective, address licensure, scope of practice, payment, workforce development, the issues that we are seeing, to bring it to the forefront so that not just the folks who are serving families know about it, but the whole community knows about it. And this is why we hope that you will stay involved and come through to the future teach-ins, because the future teach-ins will have similarly a focal topic, and 2 accents of other issues that are also existing, that can come to focus in another teach-in to come. And they can also involve updates where we can chime in on what's happening with our bill or our other initiative or an issue that we're noticing in our region, in our borough. So this will be a place that we hope that you guys will just stay tuned with, because it's going to be your voice that we eventually need when our calls to actions come up. When we say push these buttons, because we're getting all that set up in the next couple months, where people will be able to email their legislators and, you know, understand like what actions we actually need from you. But it really starts with being informed. So as you can see here, the upcoming dates, we have the teach-in today. We have the press event on February 4th. We're going to have another teach-in on February, I can't read the date, 25th, on February 25th. That one's going to be focused on CPM licensures, which we so desperately need. And then we have a lobby date TBD, but we're going to get people's input so that we can make a very impactful, successful event and bring these topics directly to our legislators. So we hope you all are feeling motivated. And if you want to drop in the chat any words of what you are actually feeling, that is welcomed and wanted. Our goal is for you to walk away a little more informed than how you came. And thank you for your time, your energy, and whatever lane of work you are in right now, that you are just charged with more energy to keep doing it, because we're in this together. Thank you.
Thank you. Thank you so much, everybody, for joining us. And thank you for all of the comments in the chat. It's so nice to see everybody engaged and talking about these issues. As Mila said, please join us, join the coalition. If you want to just keep up to date on what we are doing, that same form, you could just say, I'm not ready to join the coalition, but I want to receive the newsletter. So you can just check off on there, and we'll let you know as the details evolve about our Albany trip to meet with legislators and advocate for all of these changes that we want to see in March. We would love to have you come with us, even if it's just for that day, or if you can call or do virtual meetings. We'll equip you with all the tools that you need to help advocate and make sure that all families get better birth outcomes in New York State and beyond.
In the meantime, excuse me, I thought you finished your sentence. In the meantime, look at www.mobilizematernalhealth.com. And that's a place where you can stay tuned with what's happening. And we will put one-pagers to all the different legislative initiatives that we want to keep on the forefront of people's minds, as well as you can browse the site for really helpful resources, articles, just to keep you abreast of what's going on. So we want it to be a repository of helpful information for anything maternal health related and birth justice related. So yeah, we'll stay in touch. Thanks so much.
Thanks, everyone. We hope to see you on February 4th.
Take care.
Bye.